Hello and welcome. This is From Day One. My name is Nick Bailey. I'm one of the founders of From Day One. And welcome to our webinar. We're going to be exploring a pressing topic, filling the information gap in employee health and wellness. To give workers healthcare benefits that anticipate their needs, HR leaders need direct line of sight into their workforce health. They don't always have the relevant data to make informed business decisions, and they might not know how their employees are really doing. While respecting employee privacy, how can companies get a better sense of what workers need and value while giving them the tools to make smart decisions about their health and wellness? What kind of data and analysis can drive insights and help leaders accommodate their diverse workforce? Before we dive into this topic, I want to just give a quick shout out and thanks to our partners, League, Justworks, and Lumapps. I'm going to tell you just a little bit about each one. League is North America's leading health operating system designed to provide a single access hub for employees to engage with their health, lifestyle, and benefit programs. This panel discussion is particularly meaningful because it aligns with League's data-driven approach to improving workforce health and informing employers' pandemic readiness and management policies. Justworks makes it easier to start, run, and grow a business by giving entrepreneurs and their teams access to simple software and expert support for payroll, benefits, HR, and compliance. To discover more helpful content for small business leaders, explore the Justworks blog. And I should note that from day one, we are actually Justworks customers and very happy. It's a great product. Lumapps is a social and collaborative enterprise communication platform designed to connect, inform, and engage employees no matter where they are working. This innovative digital workplace equips organizations to break down silos, streamline internal communication, and provide a space for employees to belong and have a purpose. Fully integrated with your productivity suite, Lumapps simplifies access to all corporate content, business apps, and social features in one place. Now for a few quick logistical or housekeeping items. This webinar is being recorded. It'll be available on demand in about 24 hours after the event. Look out for an email about 24 hours from now with that link. That email will also have info on SHRM, SHRM credit for this session. And look out for a written account of the conversation next week on our website. That's From Day One, FROMDAYONE.co. Around 3 p.m. or 1 hour from now, for those in a different time zone, we'll have a Q&A session. You can submit your questions at any time using the Q&A button at the bottom of your screen. Feel free to start now or anytime during the session. And now, I'd like to introduce our moderator, business journalist, Lydia Dishman. She reports and edits for Fast Company on tech and leadership and has written for CBS Money Watch, Fortune, and the New York Times, among many, many others. Lydia, thanks, and over to you.
Thank you so much, Nick. Thank you all for being here. I have a stellar group of professionals with me today, so I'm really excited to dive into this discussion, which is extremely timely as we are moving into what is for most month 3+ of this COVID pandemic and its attendant quarantines. And I did want to start by telling you all about a stat that I just came across that I thought was particularly relevant to this discussion. It's from Gartner, and they found that by late March of this year, 68% of organizations had introduced at least one new wellness benefit to aid employees during the COVID pandemic. And before that, Gartner research revealed that 45% of well-being budget increases were being allocated to mental and emotional well-being programs, indicating that organizations were prioritizing employee needs in this area. So we are going to be talking a little bit about that and the tools to assess those employee needs and how benefits are changing. So without further ado, I'm going to ask my panelists to introduce themselves and tell us a little bit about your work and how that work has changed since COVID. So Jennifer, let's start with you.
Hi everyone, I'm Jennifer Lavoie. I am the Director of Employee Wellbeing for Piedmont Healthcare, and my job has changed due to COVID. We've definitely moved toward mental health with a great deal of focus with mental health. During COVID though, I found myself facilitating on-site childcare resources, which was something I'd never thought I would be doing. We usually have partners to take care of that, but we expanded that partnership so that our employees would have a safe space to bring their children And of course, we also set up a crisis line for our employees that helped them get any type of support that they needed. So those are two quick examples.
Roger?
Hi, I'm Roger Dowdy. I'm currently the Vice President of Mental Health Strategy within the Population Health Department at Providence St. Joseph Health System. I'm a mental health social worker by background. Just quickly, Providence St. Joseph is the third largest nonprofit health system in the country, ranging from Alaska down to California, Texas, New Mexico, and then up to Montana. And so really, one of the things that really impacted us was we saw one of the very first cases of COVID in the country in one of our medical centers, and really very quickly realized the impact that caring for COVID patients and the isolation and was having and taking on our caregivers. We have over 100,000 caregiver employees across the country. And particularly in those areas that were impacted by COVID, and how do we shift and address those needs and support our caregivers so they could continue to be providing care and support their own resiliency and get them connected to the care that supportive wellness care that they needed as they were doing their jobs every day.
Fantastic. Let's turn it over to Maria now.
Hello, everyone. Maria D., the Executive Director for Workforce Wellbeing for Kaiser Permanente, and I sit in the National Human Resources Department of our organization. Life has been quite significantly different. I think, like Roger, as a healthcare organization, we have been first and foremost thinking about our frontline workers, looking at ensuring their safety, and now that we're kind of looking at reentry, workforce reentry, ensuring that as we think about the new telework environment, the needs of our frontline workers, really just taking a step back and looking at our programs, our well-being programs, and ensuring that we are agile and being responsive to the various needs, by demographics, by job function. It can really range, and I think we found ourselves really kind of looking at our workforce a little bit differently. Obviously, from a national perspective, it's kind of hard to look into the different diverse needs, but it's really forced us to do that in this time. And so, I think even myself as a telecommuter, I even had my own challenges adjusting post-COVID days. I thought I had it all figured out, but I've got 4 kids from elementary all the way to college, every grade that you can think of. And I have my own unique challenge, particularly in mental health, even though I lead the mental health strategy for our workforce. So I would say that we are not immune. We are all impacted in all sorts of ways. And it's really kind of forced us to think about how we present our workforce well-being programs differently than we have in the past.
Robin, why don't you take it next?
Sure, sorry about that. My name is Robin Schroyer. I work for CommScope, which is a global telecommunications company. The company has roughly around 28,000 employees around the world, and a significant portion of them are in our manufacturing sites. We are considered an essential workforce, and therefore we have been able to maintain our employee workforce. But with that comes its own set of issues in relation to our employees being very stressed around COVID. So not only our remote workers, but also those there. And so while our safety teams have done a phenomenal job with that, we definitely have seen a lot more emotional stress, both on site as well as remote. And there are different challenges with both of those types of situations. It's changed the way that people interact. And again, just as Maria mentioned, a lot of stressors outside of just the typical day-to-day job and acclimating to an at-work home environment. So we've really taken this as an opportunity to have wellness shine, because for the first time in a very long time, in my humble opinion, we have a large emphasis on mental well-being, and I want to take full advantage of that. So.
Thank you. And last but not least, Michael in Mission Control.
Hi, everybody. It's Mike Serbinas, founder and CEO of League. We help companies transform their health and benefits offerings with our platform, our health operating system. As a rocket scientist turned tech entrepreneur, for me, healthcare really seemed ripe for change. This idea that in the future, we'd all want something more digital and Netflix-like, less like my grandparents' cable TV. And in building the company, what I've found is, most of the focus has been largely on cost or perhaps culture. But what COVID has shown us is that all of a sudden health is mission critical and digital is a must. And HR leaders have all of a sudden become not just HR, but chief medical officer, chief epidemiologist. The pressure has been on all of our customers, and the frequency of things that they've had to do, the frequency of their challenges have gone through the roof. So they've been dealing with, workforce planning, whether it's temporary or permanent shifts to remote work, the need for more virtual resources, as a number of panelists brought up, the need for more mental health, the need for return to work solutions. How do you even do that without data and understanding where your people are, what their potential health conditions are, how they commute, et cetera. And, how do you plan for this potential third wave of challenges and costs due to mental health, addiction, caregiver fatigue? It's been really an intense time, and we've been focused on helping those HR heroes.
Thank you. That leads me into my next question. Maria touched on this just a little bit, telling us about her having 4 kids at home, which is certainly a challenge that I think many workers who are working from home are facing, balancing homeschooling and getting work done. So can you tell me, all of you personally, how this shift has affected you and how it's affected your managing of your teams? Let's do like the microcosm first. And how are you checking in with them to make sure that they're not burning out and they are able to get the resources that they need? So Maria, I'm going to put you on the spot again because I'm very curious to know how you're managing.
Yeah, well, I think as a team of well-being professionals, the number one, I think, stressor for our folks is that, they kind of assume us to be resilient. They assume us to be, we were the food police. We were the ones that told people to get up and exercise. We were telling them to get together, to celebrate in potlucks. And now we're kind of forced to do things differently and actually model the way, when in fact, many of us were struggling with getting removed of being out of those social environments. So we really leaned heavily on our team's platform. We made commitments to use video more often. We're still not at a point where we're doing it all the time, but making it a point to see each other. And not just with our workforce, developing tips for the organization around doing things like coffee breaks, buffering in time before your meetings to connect in, and outside of work, checking in on what's working, how are they feeling. We've even got a whole channel where we just put up pictures and share stories outside of work, just to kind of remove ourselves out of the element of work, because work and personal life is kind of blending in so heavily. And so, those have been the key things that we've done. And my team is actually in all parts of the world. We have people in California all the way to the East Coast. So that has really helped. And I think just because we are kind of creating these tips for our organization, we're forcing ourselves to practice those things that we're preaching.
I noticed that Marco has joined us, so I'm going to put you on the spot right away and have you just introduce yourself. And my question to the group is, how has the shift to remote work affected you personally, and how are you managing to get a sense of your team's health and well-being, just within your little group?
Yeah, no problem. First, make sure you guys can hear me, right? Yeah. Okay, great. So, I would say there's just generally a lot more sense of pressure, right, in this post, work from home world. And that probably comes from 2 arenas. One is the same shared sense of pressure that everyone feels when their work and life have so holistically merged and not in a planful way, not in like the way that somebody who purposely says, hey, I'm going to have a work from home type of job and a work from home career, but rather when you're just sort of like sitting in your living room, you know, with a lot of children and everything else sort of running around. But then for many of us in the HR field, you know, this was coupled with probably like being busier than you've been, you know, in the last, you know, I can't even remember how long, with, you know, the multiple iterations of what this meant, right? So in its earliest days, there was a question of, you know, what do you do with employees who've been identified to have been in proximity with someone with COVID? And how do you alert their staff? And how do you, you know, and should they be quarantined or not? Is that an overreaction? And then that quickly, you know, transferred to, okay, wait a minute, actually, we all have to work from home. So then everyone work from home, and like, how can we be up and running, and, you know, and all that type of thing. And so just been that kind of pressure. For the team generally, though, what we have done, which has been excellent, and we didn't do this right away, it didn't occur to us until like a week or two in, a couple weeks in actually, is we started just a 15-minute morning check-in every day. And that ability to just see everybody, you know, it's awkward and kind of funny, and see them in their natural environment. And some, you know, some people are living with their, like one of my colleagues lives with her 90-year-old dad, and he'll come by and wave to us and stuff. So it just created a much more humanistic and, you know, approachable moment out of something that otherwise just seems so like disconnected.
Does anyone else have anecdote like that, where you have been doing these frequent check-ins to make sure that you can lay eyes on everyone and make sure everyone's okay?
Yeah, I've gone from weekly exec meetings to daily stand-ups. And in fact, I ask that we all hike or walk while we do it, which kind of keeps you moving, because, you know, you do so many of these Zoom calls throughout the day, your back, your body, you know, it's kind of hard to sustain it. And we've also had to build in what we call flow time. So we require that nobody books meetings for a 2-hour block every day. And then it's a 3-hour block from mid-afternoon on Fridays till the end of the week. And just to give people time to do the things that, you know, they need to do. All of a sudden, I've had to become a second grade teacher, you know, and my 8-year-old is running around saying with tears in her eyes that she can't get on to her 4th Zoom call of the day. And, you know, so we've realized that we've had to increase our face time, but give people space. And frankly, while we still have, you know, targets and performance, you know, we've had to like reshape our thinking of the pressure that people are under, and give them the space to manage and cope and find their way through it.
I want to take it to the macro level now, especially with respect to some of you who are working in very large organizations. Since they're, you know, some of you are you know, having frontline workers who were not able to work from home at all, but now with this, you know, reopening gradually in some states, how are you all dealing with this with respect to employee well-being? Like, are you putting forth safety guidelines? What are you allowing team members to come in with their concerns? Like, how would they report that? Jennifer, why don't you take that one first?
Sure. We are really partnering with our infection prevention team to make sure that all of our reopenings and return to work is being done very carefully, and also taking into consideration the level of comfort of various teams. And, you know, one of the big issues is wearing masks, and how we are acknowledging that, yes, that is extremely uncomfortable, but we really have to mandate that for our employees. And for those of us who are leaders, it's up to us to set that standard. And we have fitness centers, so that has been a tricky, and we have unmanned fitness hubs, which we have not opened yet. but we are negotiating certain practices for those, and we are opening up. All of our fitness centers are open right now, but it is, whew, I mean, it has been really a challenge to do that, and we recognize that our employees need these outlets. So we're trying to get these things stood up and running as safely as possible.
Roger, do you want to take that next?
Yeah, for us, it really varies by the region and what the specific circumstances are in that community, and what the state recommendations are. But we are definitely, most of our caregivers, of course, aren't able to work from home and are providing care in our hospitals and medical settings. And as things have started to open up and we've been able to increase more outpatient procedures and outpatient visits, we're certainly doing that under very prescribed standards to ensure the safety of not only our caregivers, but the patients that we serve. And for those folks at the system office or administrative capacities, really giving everyone the flexibility and encouraging people to work from home as much as possible.
Robin?
Sure, thanks. So one really important aspect for us is to understand what and how people are feeling as a reaction to all of these changes. And our organization sends out several surveys, both from a corporate standpoint, but also from our local sites, so that they have that little more personalized view, if you will. And again, we're just trying to understand, how are you feeling? What does this look like? What are your concerns? And we ask them outright, because that's the best way to find out how you can tackle it, right? We also are very big in our communication and our communication strategy. Since day one, we have been communicating. We have created digests. We do Wellbeing Wednesday chats where it's open to everybody and it's in different region time zones. So anybody and everybody can join them. We do a lot with our online resources, with virtual webinars and things like that. And some of those are how to manage in stressful times, how, giving resources to our employees is paramount, and really communicating all of that. We've also created a specific intranet site for our COVID-19. So, and what's housed on there is all of our safety, travel, well-being, all resources needed. In addition to that, it also has a lot of our reopening information on there. And as far as that goes in the facilities, we definitely are taking a very conservative and phased approach to being more conservative than the national guidelines at this point. And again, a lot of that is in response to how our employees are feeling, as well as some of those safety measures and what's realistic for us as a company, with so much happening in our manufacturing sites and everything else. So really trying to be fair and not overwhelm our employees, and make sure that everybody's well-being is at top priority.
I'm glad you mentioned some of those things, because I was thinking about what the employer's responsibility is during this time to engage workers around health and well-being, and what tools are being used to assess and then measure that engagement. How do you know what is working? So, I'd love to hear from all of you on this. What is the responsibility of your respective organization, and what tools are you using to measure?
I can jump in. So, I mean, ultimately, I think the responsibility of all employers is the health and safety of their employees, and not making them come into a situation which is ultimately dangerous to them to be in, right? And this goes far beyond COVID to OSHA and just general, things that we would be concerned about. In terms, I think, like as Robin said, one of the big things that we've been looking at is sort of like these silos, right? These like different pieces of tool sets that we will ultimately pull together. So the first one being surveys. So this is a sense of, getting a sentiment of checking in, how are employees doing, but then also, the question of, hey, if we were to open offices, would you come back? Like, how do you feel about that? We've done a lot of survey work, and what we find right now is that the pool of individuals willing to come back is expanding, but still is in the minority compared to the pool of individuals who would prefer to just sort of wait and see, right? And then frankly, there's a cohort that are saying, actually, this really works for me. Like, I never want to come back, not even related to coronavirus, right? Like, I'm just happier this way. And so I think that's a lot of the thinking we have to do, all of us employers now, is how has this changed work, and how, just generally, how it's just changed how work's delivered. The next thing is a little bit more health oriented, and that's more of a specific health self-assessment, right? Which we would then be, and this is part of the health and safety piece. This is making sure ill people aren't coming in and putting at risk the rest of the population. So this would be some type of daily self-attestation tool, and the marketplace for that has really like exploded over the last few weeks, which people would simply click through to say, I don't have a fever, I don't have shortness of breath, I'm not symptomatic with COVID type symptoms. And then as you go down the line, you would want some type of contact tracing, which would help us, should someone actually have or be diagnosed with COVID, an easy way to understand who had they been in contact with recently, and those types of things. But it's been a moving target, and probably for many of us on the call, it's the same. We originally were thinking like, oh, everyone's got to have tests. We've got to have all these tests done and rendered, and like, how are we going to render all these tests? But then like the science on the test has proven to be, somewhat problematic. And additionally, we were thinking about temperature checking, but then there's like, 60% of people that could be actively shedding the COVID virus would have no temperature. So you didn't really solve much by mandating that. Could be an amalgam of all of those, but I think as new information comes in, our strategies also morph over time.
Maria, you want to take it next?
Yeah, so very much similar to what a lot of the other folks here has said. I think first and foremost, we nationally had created guidelines in the various spaces, whether it's how our facilities are reopening, down to workforce reentry, and setting national guidelines, but still allowing our various regions and even locally to use those guidelines to guide their reactivation plans. But in the terms of well-being, I think what has really stood up for us is that we have a really good listening strategy. We have been serving our workforce even before COVID on how, as an organization, our employees are perceiving that we're supporting their well-being. So we have a set of 6 questions that we've asked since 2012, and we asked that question again, one of those questions around the support of well-being, in a survey that we call COVID-19 Experience Survey. And in that survey, we're actually encouraging our employees to tell us how they're feeling. It's very simple questions. They're open comments that we invite as well to understand the sentiment around what's surrounding them and how they're feeling and reacting to the current environment. And so you can take that as often as you like. We're encouraging them to take it, every day if possible, but that's really giving us an indication and having a pulse on how the changes in feelings are happening over the different phases of recovery. So we're really using that to inform strategies. In particular, how do we support our managers as they support their employees coming back? And obviously, mental health is first and foremost, right? And we are actually even being intentional about inclusion and belonging as part of that reentry. So taking all of those elements, providing them the skills, pointing them to training that's already existing has been really at the forefront, and it's kind of peppered throughout our workforce reentry guidelines so that managers are equipped to point our employees to the right resources. We have a robust employee assistance program. In fact, I think we're one of few organizations that actually has consultants staffed internally. In addition, we work with a vendor to support hours outside of our normal business hours. So we feel that we've kind of put a lot of resources and attention to supporting the mental health of our workforce.
I want to get to everybody, but I know that we're coming up on the half-hour mark, and this is the time when we do our station identification. So I'm just going to invite Nick back briefly.
Hello, how's it going? Thanks so much. It's been a great conversation so far. Thanks to everyone at this. Just want to remind anyone joining that in midstream, we are from day one. This is filling the information gap in employee health and wellness. Our sponsors are League, Justworks, and Lumapps. And as a reminder, you can submit your questions at any time, and we will answer as many as we can during the Q&A session. And now back to you, Lydia.
Thank you. So yeah, I want to continue on this thread. Mike, why don't you take it next and tell us what you're doing to measure engagement and in health and well-being?
Yeah, so for some context, as a tech company, really our greatest and our primary asset is our people and the technology platform we build. So for us, health is priority one. And, you know, this is week 14 and a half for us of full working from home. We've got, I would say, a pretty young population that's never been through anything remotely like this. Many of them weren't even working in the 08-09 crisis. So getting a handle on how they're feeling, pulsing with surveys every week. We've been doing that all 14 weeks of this crisis, collecting information not only on how they're feeling and their general health, but also on preferences. We too have seen that the preference to return to work has gone up. If you are single and in a 600 square foot apartment or a home with young kids, this is really hard, and people are really excited about coming back. Transparency has been pretty key, as there's a lot of anxiety around what is happening in the economy. And this idea, and I think Marco touched on this, you know, around, well, what does work look like beyond this? And we have, you can imagine, a ton of engineers who are like, I've been waiting for this moment my whole life. I'm going to work this way forever. And had incredible anxiety about even the thought of coming back. So we've gone to what we call virtual league, a permanent option for people to stay at home or work their way. And as you can imagine, we've revamped all of our business processes to be able to work this way indefinitely. We will not be the first or the second to go back to work. And I guess something that we've learned, and we know this through our business, is that most people actually think about their health through the lens of their benefits. And that usually comes from their employer, through their health plan, through their employer. And, you know, most people are running a very traditional model. And some have started to innovate and put in solutions for various aspects, whether it's mental health or diabetes. And this sea of point solutions that are out there becomes even kind of harder to access when you don't have anybody in HR that you can go talk to easily, or you don't know who, you just don't know where, and it's a treasure hunt. And so this idea of helping people bring it all together is something that we do with our platform, and we've seen it with our own employees, that them having access to this information. And by the way, us also being able to access data that, frankly, with our software enables return to work. We've really, even as a tech company, have leaned even more into digital infrastructure. And honestly, I see that is accelerating among the hundreds of enterprises that we deal with. We all need more digital infrastructure to not only help sustain this, but manage COVID going forward and whatever comes next.
Roger.
Yeah, I think there's a couple different pieces to this question. One is, how does an organization listen to the needs of its workforce? And there's all kinds of different avenues for that would depend upon the scale and scope of the organization, geographic spread and whatnot. But I think, so one is just listening, and the second is, what do you do with that information? How do you address those needs? And it's hard not to argue that there's going to be this third wave of mental health needs as a result of this COVID experience that we're all having. And the Wellbeing Trust, in partnership with the Robert Wood Johnson Foundation, just recently estimated there's going to be an additional 75,000 deaths of despair as a result of what we've been experiencing and will continue to experience here in the coming months. And certainly that has a huge impact on workforce productivity and retention of employees. And so I think how organizations address those needs are going to be really key. And one way of doing that is through your EAP, of course. And some organizations have fairly robust mental health and wellness EAP. There's a ton of vendors in this space right now, and some of them are quite good. But most people don't access mental health care through their EAP. They access it through their healthcare benefits. And the literature there is that for people who have an identified mental health need, upwards of 60% of those patients never get access to care, never get necessarily identified and access to care. So how do employee organizations, particularly self-funded purchaser groups, those that have leverage in the marketplace, to have those conversations with the insurance carriers and looking at what are those healthcare outcomes? How quickly are their employees who are in need of mental health services getting access to an assessment, getting access to treatment? What percentage of their employees are getting screened for mental health and substance use disorder concerns? What percentage of their employee base who have been identified at high risk of suicide are getting the evidence-based treatment for that, which is the safety plan with means reduction? And so I think those are some of the things that are really data-driven. And it also is a way that the employer groups can get that in aggregated data. So you're also helping to address the privacy wall that is really one of the problematic issues in terms of data for employer groups.
I definitely want to talk about privacy, but I want to make sure that everybody weighs in on this particular thing. Jennifer?
I appreciate what Roger had said about access to the mental health resources. You know, at Piedmont, we have 11 hospitals, and we're spread out all across the state of Georgia. And one of the things that I recognized for our mental health needs is that we have a pretty strong EAP program through our carrier. It, to me, though, it was just difficult to get through to. There's a lot of prompts, and we have individuals that are in crisis, and they really need some direct assistance. So we were able to work with our carrier and set up a crisis line where there was basically one prompt, and our employees were able or are able to get the help that they need immediately. And I was really grateful to our carrier about that, to be able to do that. But another thing that I have identified, and one of the things that we do is we get our data through employee surveys that we do through our mobile wellness and benefits platform. But we also have wellness teams at every location. So we actually have 13 wellness teams. We have 11 hospitals, a physician enterprise corporation, and then we have our system office. And what I learned, and we had a wellness team meeting today at one of our smaller hospitals, and I learned that they don't want to reach out to EAP. They want some warm face-to-face with individuals. Fortunately for us, we do have a small army of qualified wellness professionals that can address that, but it just goes to show there's so many stones that we need to turn over and make sure that we're meeting all of our employees where they are.
Last but not least, Robin.
Well, I do think that everybody has really covered, exactly what we're seeing. We are seeing that, we do have a large population that are very happy where they're at, and they kind of want to stay in that virtual world. A smaller segment of the respondees of our surveys are saying, we'd like to go back, or maybe go back on a flex schedule. So these are things that we are experiencing. I think to the point of EAP, that is something that we have really pushed out and extended, but we've done it in ways outside of the box, because there is that, as much as I hate to say it, we still have that very negative association with therapy or a mental health resource. And so when we talk about it, we promoted, our CEO sent a letter that said, if you are experiencing any anxiety or any negative association, please remember the company has guidance resources, right? And that's what we call it. And so we have it coming from the top, where our senior leadership is very much supportive. But then on the other side, on our surveys, if somebody answers to a question, how are you feeling at this time with everything going on, and if they say unwell, then it automatically goes to a question of, did you know we have, and then that lists the EAP services. A lot of things that we've been doing with those is creating webinars, and some of them are on how to deal with your kids staying at home. So it's things that are outside of the box necessarily, but it's still talking about the anxiety, the frustrations, and everything else that people are feeling. And it's getting to the root of how can we help you in your situation in this time. And we've been doing a lot of webinars with our 401k and pension folks with financial well-being. So really looking outside of the box and what are people needing? How can we extend and utilize our vendors to the max and really get to the root to be able to assist our employee population to the whenever, when, or however they need it.
I mentioned that I wanted to talk about privacy, and I think that you can't talk about privacy without talking about trust. And I think that especially during a very stressful time, and people are making these transitions regardless of where they're working. You know, working from home has its own stresses, but those employees that are still on the front lines are dealing with an incredible amount of stress as well. So how can you be sure that the individuals trust the organization enough to really report what they're feeling? And what is your responsibility in your organization to ensure that they understand that everything is private? That's a mouthful, but again, I want everyone to answer this one because I'd like to hear about what each organization is doing. So Marco, since you started the last round, I'm going back to you.
Okay, sure. So, I mean, I think, you know, one thing is being very selective about what do you ask individuals, right? So what are the questions we got to? So what we have a tendency to do, this isn't related necessarily to COVID, this is just broader speaking, is, you know, we will collect data inputs from each of our vendor relationships, right? Which are going to always be aggregate level, right? So it never would be down to the person. And what we need to understand there is sort of, each of those are only going to tell us, you know, what that one vendor works on. So if it's health plan data, right, it's just going to be about people's doctor visits, hospitalizations. If it's pharmacy data, it's just about the pharmacology, you know, of our employees. If it's disability data, et cetera. So, you know, what we try to look for are patterns or things across in a longitudinal way that might tell us and give us insight to our employee population. So for example, if we're seeing a lot of pharmacy spend on mental health, right, but very little medical, you know, physician visit or psychological visits and mental health visits, then what that says to us is that we have people who are suffering, right, who are getting treated probably by more like primary care physicians, and maybe we have like an access issue, or maybe it goes to what Robin was talking about, you know, about feeling like, oh, this is, you know, sort of looked down upon or what have you. So those are the ways that we could sort of meaningfully adjust the offerings we give, what we communicate, what we're marketing, how we're getting out there, without ever having to actually go to people and say, you know, let's understand this. Another thing, just to be real quick, but is to leverage vendors to provide messages that maybe would feel weird coming from an employer. So for example, we use a maternity program called Ovia, and Ovia is a communications channel with our pregnant employees long before they would actually have come forward to HR to say, I'm pregnant, right? So normally people are going to wait till past their first trimester. And with HR, frankly, they're going to be waiting until they're showing, and they have to have a conversation about like what time off looks like. And that means a lot of like important messaging maybe we would have had in those early days was missed. So by using an intermediary, right, we're able to get those messages out. So sometimes it is through aggregate data, right? So respecting privacy through that because it's aggregate data, but then looking for where the issues are and then sending out messaging that we know will resonate. And the other way might be using a third party, it could be an EAP, whatever, to get messages out. But in both instances, employees can feel confident that the employer, right, their manager, their HR team would never know like what their specific circumstances are, because it does come down to trust. And I think, frankly, it's just hard in a employer-employee relationship to maintain that.
Mike, I want you to take this next because you have both internal and external.
I feel like this one is a softball for me. Thanks, Marco, for the great lead-in. You know, what Marco described is what our platform does. We bring in data from all the different aspects of health and benefits into a data lake, data warehouse. Our software analyzes it and makes recommendations at the aggregate to the HR professional, like you've got these risk segments and here are mitigations or things you can turn on to proactively get ahead of those turning into big problems for your population from a health standpoint, from a cost standpoint. And then in the specific, because all this data comes into our platform, we have got software that can make recommendations to the end user. Similar to Marco's Ovia example, we can make recommendations to the end user, not only to participate in using a digital program or a health provider or service, but then once they've started to, to nudge and remind and to help them adhere. And it turns out that that data-driven approach not only helps you make better macro decisions, but it also helps you make micro decisions for the end user. And it works because when we have the data, we don't ever give the specific end user data to the employer or to the health plan. We only can act on it on the behalf of the end user. And that's how our privacy policy works. And that's frankly how end users come to think of us as a trusted companion or a friend in health. We're like the Switzerland, in terms of repository of their health data, and we don't give it to anybody in the specific. We only leverage it for their benefit.
Thank you. Maria, Kaiser Permanente is how many people in its workforce, and how are you dealing with this issue?
Yeah, we're over 210,000 employees across the organization. And I'll tell you, this is the #1 problem we battle with constantly. Because we're an integrated healthcare system, there's always assumption that, we have insights into data. And the truth is that we are no different than any other employer of Kaiser Permanente. And that has been kind of our core message that, we don't pull data any differently. We don't ask for data to be sliced and diced any differently than any other employer group that works with our health insurance company. And that can only take us so far, right? So, like everybody else, we receive our information in aggregated form. And even when we do our employee engagement surveys, the survey I talked about earlier, not every manager will get a report because we have minimum thresholds in order to get even aggregated data at the team level. So, for us, it's really taking a combination of different types of reports from focus groups, so we'll get a lot of anecdotes, and those are employees and managers willing to give some information to dig in a little bit deeper underneath some of those engagement surveys that we'll host, to anecdotes from our champions. We have over 3,600 health and safety champions across our organization. And those are frontline employees doing wellness activities who will surface to us the challenges that they have day to day in their various environments. So for us, it's kind of maneuvering through all the different data points that we have, seeing correlations where we can, and that's the best that we can do. So I don't know that everybody has solved it yet, but we really try to do nothing different than any other employer group would do, working with their health insurance companies when it comes to retrieving health information and data.
Roger?
Well, I think it's a couple different things. So one is, how do you utilize that information that you have and to be able to drive some of that change. And we know that most people are not comfortable sharing medical information with their employer, let alone mental health information. And so how do we make that more easily accessible? And I think it really comes down to culture. Having some of those organizations that have been most successful have senior leaders in their organization who are willing and comfortable sharing perhaps their own lived experience with mental health concerns or family members' concerns, and really being that voice of that champion. And then how does your health benefit design, for example, reflect those priorities? How are the copays for behavioral health visits related to other specialty visits? Are you making it easier, incentivizing your employee groups to access those services by having no copays, waiving copays perhaps, or making them as low as possible to try to encourage people to access those services.
Jennifer?
For us, we have, we use our aggregate health plan data to identify what is needed around our healthcare system. We have about 25,000 employees, but there are small pockets, small little hospitals that we serve. And one thing that we do is we just continue to talk about how we get the data and how it is aggregate data and how their privacy is protected. And at times we go really deep into the weeds to make sure that the employees understand how we are really mining that. So we're not. We have our tech partners are mining this data, and then we're getting the very important results of that so that we can all be delivering what we need. So for me, I have experience that I really just need to continue to tell the story and answer the questions, answer the tough questions. And sometimes it gets a little detailed, but I really want to make sure that our employees understand the lens that we take to make sure that everything is protected for them and the legality of that too. And once they know what is set up for them, they begin to feel a little more comfortable with that. And we're getting there.
Robin?
So we too also, we use a lot of aggregate data. We utilize all of our vendor data. And when we look at that, we look at trends, we look at guides. For example, we noticed with some of our healthcare that individuals were going for large mental health issues. And we then worked with our EAP provider to start looking at in-network providers first before we start doing that. So we've really tried to couple it and utilize it in the best way. But like previously mentioned, with our smaller regions, they don't get some of the data and we don't get some of that data because it is very easy to identify people, and that's something that we do not want to do. CommScope takes privacy very seriously. So, it's really just looking at what all those data points are from our vendors, all of our survey data. When we do webinars, when we do anything, we try to send out a survey, and we hope that people will respond honestly, because we always ask, what do you need? How can we help you better? Because when it comes down to it, your employee will tell you, and you just have to listen and then act. So, it's really important for us to look at those trends and move forward accordingly. We do get it regionally, so we do take that into consideration as far as those cultural differences and environmental differences, but everything is always aggregate.
So from what I'm hearing, you are combing this data and analyzing it, slicing and dicing it a lot of different ways to make sure that everybody's on track. When you have to offer additional resources, though, what does that look like now? I'm just curious because I keep hearing about telehealth and, specifically for EAP programs, mental health coaches are being seen on video, and other health services are being issued through video. So how has that changed for your organizations? Who wants to take that one first?
I'm happy to do it. I'll be super quick. So we have been getting reporting from our health plan on a monthly basis, and we've seen a 2,262% increase in telemedicine. Yes, nuts. And so what's interesting about it, though, is there was such a stickiness to brick and mortar healthcare, mental health care, et cetera, right? And for 15 years, we've been begging and pleading and cajoling employees across all the organizations we work at to think about the shift to telemedicine in all the incremental methods that telemedicine was over time. The good news is that so many of us already had a telemedicine solution in our portfolio, albeit grossly underutilized normally. And so it's interesting to see how people were able to quickly shift and say, oh, okay, I will try this. I've been hearing about it for years. Let me give it a shot. What I'm super curious about is what the future holds. Will those telemedicine numbers stay high, or will they shift back to brick and mortar as soon as people have the opportunity to do so?
I think one of the challenges in this space is that telehealth is really phenomenal, and it's really table stakes nowadays. And we've seen more innovation in telehealth in the last 4 months than we did in the prior 20 years. And part of it is a result of one, certainly the need, and two was the removal of some of the restrictions that were inhibiting the growth of telehealth, primarily by Medicare, in terms of payment parity, in terms of some of the other restrictions that made it difficult to do. I think so. There's the face-to-face or interface that telehealth brings, much like we're doing right now. But for behavioral health, there are also, if we think about upstream, there are also what are called digital therapeutics, which are online therapy modules. Think about those old books when we were kids, that choose your own story kind of books, as kind of how these are developed. And then there's also behavioral health coaches, as you mentioned, and sometimes those are usually through an app, and sometimes they're synchronous in real time, and sometimes they're asynchronous. The challenge is that in the fee-for-service healthcare system, there's no reimbursement model for those latter things, the digital therapeutics. So there's no billing code that we're able to drop to utilize those. And so it's very difficult to adapt those in our markets. It's a lot of adoption in the EAP systems because the financial risk and the ability to pay for those comes out of course, a totally different funding mechanism. And that's really where we're seeing the biggest explosion of these kind of services is through EAP. And it's a great utilization. And really it's about getting people to the right level of care as quickly as possible. If you think about somebody who has relatively mild or even subclinical depression or situational needs, they don't necessarily need to go see a therapist. And if they try to go see a therapist, sometimes they have to call 25, 30 people to find somebody. Whereas if a digital therapeutic tool might be an appropriate intervention, they can get that within a matter of minutes. And so I think that's where we're seeing the biggest initiation of some of these new and innovative tools.
I think like both Roger and Marco mentioned, the spike in virtual care or telehealth is here, it's happening. But the question is what happens afterwards? And what we really see is kind of a virtual care 2.0, where really you're not going to want to see a doctor all the time. You're going to see a whole host of different providers or digital providers, digital therapeutics. And how is that going to work? Are you going to deploy 50 different apps or services to your employees? We don't think so. We think what you need is the equivalent of the OnStar button for digital health, where you press it to get care, and that may route you to a doc, it may route you to a nurse, it may route you to a digital therapeutic or an app of sorts. And that idea that virtual care is not only going to become bigger, it may not stay at the 2,200% lift that Marco mentioned, but I think it's going to become broader. We're going to use digital care services in many aspects of our life. And I don't think that's going away. And I think, for those of us with kids at home, they're seeing that this is now the way you do things. And frankly, I don't think they'll ever expect it to be different. They'll just expect it always to be the get care button that then gives you access to any kind of provider at any time of the day.
I'll just go ahead and add on a little bit to that. So we have been actually promoting virtual telehealth since last year. So we were a little bit ahead of the game on that one. And now that this has happened and there is the opportunity for the telehealth with counseling and virtual coaching and things of that nature, we've really upped our communications as far as that and the different ways in which you can utilize them, as well as ways in which you would not want to utilize them. So really, again, goes back to that communication piece as far as helping people to understand what those opportunities are, and then helping them make that easy path forward.
I'll go ahead and share what we're doing. So yeah, again, as a healthcare organization and provider, we've leveraged all the great services that our organization has really put out for our members and really promoted that within our own workforce. Two particular digital therapeutic tools that have recently been released for all of our Kaiser Permanente members has been two apps, My Strength and Calm. So part of our strategy really is looking at the full spectrum from, you know, low risk all the way to high risk, and ensuring that we've got resources to support an employee regardless of where they're at in the spectrum. And internally, I think what we really leverage is our internal employee assistance program, because through those sessions, they can determine what the appropriate resources are, and if they need you know, referrals over to behavioral health, they're there to do that. If they simply need some resources and can benefit from self-service tools that we have available, then they're able to do that too. So, you know, our communications and the way that we promote our tools internally really try to touch on the different, you know, the different parts of the continuum. And so we have moved, and EAP, for example, they do all of their services now. They're used to be one-on-one in person, and now they do them all telephonically, and they host, as Robin was saying, webinars. We had one that was just around uncertainty, and it was one of the largest attended forums, and this was before all the social unrest happened. So we know there's a need and a desire, and we're finding that the virtual settings are actually working out okay. I know there was a lot of concern because people preferred the in-person, but the moment that people experience it, and if we're creative in the way that we use these virtual platforms, people are starting to understand that there's a different way to engage, and it's just as impactful.
Coming up to the top of the hour again. Jennifer, did you want to add something quickly?
I will just agree with Maria in that give virtual a chance. We did a virtual support session with our primary care physicians group, and it was so well received. So the expectation is that we do it monthly. So I think that the future is going to look a lot different, but it's going to be okay.
Just want to pause briefly again and turn it over to Nick.
Hello, this is Nick. Just wanted to remind you guys, this is From Day One. Thanks for joining us. This is our webinar, Filling the Information Gap in Employee Health and Wellness. Thanks to everyone, including you, for participating, and especially our sponsors, League, Justworks, and Lumapps. At this point, at the top of the hour, we're going to be taking some questions from our audience, and it looks like we have quite a few great ones. So I'll turn it back over to Lydia. Thanks so much.
Thank you. So yes, we do. And there are several that are asking about working specifically with communities of color during this time. And Jeffrey in particular is asking, any thoughts on supporting Black employees with mental health needs specific to their community? Our Black employees are requesting to speak to Black mental health providers, and network search engines don't have a race filter to prevent discrimination. Any creative solutions around this need? Does anyone have any thoughts about that one?
I can go ahead. I'll go ahead and start with that. So that is a huge topic for our company. And one of the things that I am doing with our EAP program is I am working with them to try to identify, when they do identify different therapists, you know, ask for these certain requirements, because they are necessary and they are needed, and it is something that is extremely important so that everybody has a voice and feels comfortable voicing their opinion in a safe atmosphere. So, you know, again, just working with the EAP provider and really asking them to help identify specific people or make a list of preferred vendor or therapists that are in network that are willing to disclose that information for the point of service. So those would be really great ways. And yeah.
Anyone else want to chime in for that?
Well, I would add that, I mean, we certainly understand that the needs of communities of color are very different, and engaging in mental health care and therapy have different needs and expertises than other needs. And I think almost every state has some insurance commission regulations around access to care that the healthcare carriers are held accountable to. So it's an opportunity to leverage that and to have direct communications whenever possible in these situations with your insurance carrier, or if you're working through a broker, to have those conversations and to make sure that those situations where people are having difficult to access care, to make sure that the insurance carrier is aware of those. Many of the larger insurance companies are actually starting care navigator or patient navigator programs to help people get connected with care, because we know how challenging it can be. One of the things that we're finding is that most folks are seen in the private practice community for mental health needs across the country. And there are some studies that are showing that upwards of 50% to 60% of those private practitioners in some communities are no longer accepting insurance at all, just purely taking cash, which makes those folks who have to access their health benefits even more challenging to access care. So really, I think, leverage those relationships and those conversations with your insurance carriers, because they are, most states, held accountable to those access standards.
We've incorporated services and resources for the Black community and people of color into our core marketplace as a part of our platform, as well as picking up on Roger's point in our navigation. So if a individual self-identifies, we've got access to some resources, and obviously that depends and varies by state, but for the digital resources, at least, available nationally.
Someone else?
At Piedmont, we work hand in hand with our Executive Director of Diversity and Inclusion, and we are really peeling back the onion to see what we can do, what more we can do with our well-being programs to ensure that, we're not only meeting people where they are, but meeting people how they want to be met and how they want to be helped. So I really appreciate that question, and there's a lot of work to be done.
I'd like to, Maria, did you want to add something? You look like you were leaning in.
I'm happy to, unless you need to move on to the next question. Well, yeah, I'll share a little bit what we're doing. Like Jennifer, we have a very close relationship with our National Equity, Inclusion, and Diversity Group. We do have a National Chief Diversity Officer, and especially with the existing environment surrounding us, we are really focused more on listening sessions to hear employees, with EAP kind of in the background, prepared to address any kind of emotional support as needed. It's difficult because I think the mental health industry in itself, it does lack diversity. There is a call to action to increase more diverse clinicians in the space, and we see that within our own EAP staff. So I think the way that we've approached that question is that for our vendor served regions, we actually have a setup where we can connect our employees if they request a specific type of consultant. And then on our internal staff, what we've done is really try to partner with our local BRGs. So not just for the African American community, but for all of those of color. And as we have our listening sessions, because our EAP is staffed, they're very well versed in diversity. They have experiences working with our diverse staff. So we haven't had quite an issue other than to really partner with our inclusion and diversity groups, and to really be hip to that with them as we kind of make our rounds and really listen to our employees around their needs and point them to the right resources based on what we're hearing, because it's so vastly different depending on the area that you go to and even within the departments that they work in. So that's kind of how we've approached the work.
I wanted to move to another question that we got from Paula. And she notes, rightfully so, that many of these organizations that you all are representing are large. And she wanted to know, when dealing with privacy and trust, what are some ideas for small companies? So if you had to make a recommendation based on what your current practices are, what might work for a smaller company? Anybody want to jump in on that one?
I mean, I'll just, a couple of things. Just for one, a lot of our conversation tends to, around privacy and health and engagement, tends to be driven by the fact that for large employers, you're in self-insured health plans. And as part of being in this self-insured health plan, you are the plan, right? So you get the information. Small employers are almost predominantly in a fully insured plan. So for one, that firewall between health insurance information and the employer is even more prominent there, because they wouldn't even be able to get it. A lot of those plans are community rated, and so it's about the details of how insurance works, but there's less information an employer would have. I think for smaller organizations, leadership plays a more prominent role, because that's an organization where it tends to be everybody actually knows the person. When you get to organizations the size of Maria's or News Corp or whatever, with thousands and thousands of people and sub-business units, there's not, you could say there is a CEO role that's going to have line of sight from most employees, but by and large, it's really fractured throughout the organization. And, the people's own impression of the company could be very different depending on who their line manager is and what unit they report into, and are they in sales or whatever. I think for smaller organizations, it's more just about really that singular person. That could be a bad thing, right? If that person does not particularly perform well in that role. But I think it's very important in a small organization for those leaders to really be thoughtful about what culture they want and how do they want it, because they will have more eyes on them and they will have more people ultimately looking to them to give that direction than a larger organization, which is more of just almost like a living organism in a lot of ways.
Yeah, I'd add the privacy issues are significant for the smaller organizations, as Marco mentioned. I think the trust issue, I think, is something that can be worked on in small, regardless of the size of the organization. And in some ways, it's easier when you have a smaller organization. And I think it's around setting the culture and a safe environment to have these kind of conversations. It's that it's okay to not be okay sometimes. And there are a couple of examples of that. So one that I'm aware of is someone who owns a few restaurants, 4 or 5 restaurants, and they had one of their staff, a frontline staff, died by suicide. And they decided, the owner of those restaurants decided to use that as really a sentinel event and say, to make it his mission that would never ever happen again to one of his employees or their family members. And so they brought in what's called mental health first aid, which is a sort of a way to think about it. It's like CPR, but for mental health, which helps to train folks in being aware of what the warning signs are, and help people to become more comfortable with asking whatever the right questions might be, what those next questions might be, and then getting people to the right level of, to get to resource, to get help if needed. I think so often in retrospect, people think, well, I didn't know, or I wasn't sure what the warning signs were, and or I didn't see them. And so the idea is to have as many people as possible have mental health CPR, have mental health first aid, and be aware of what those are, and have some degree of comfort being able to ask some follow-up questions and express that they care. And so that's an example of where a relatively small business decided that they were going to take on this issue and really help educate, and what a strong message to be sent to all of their employees, that this is something that's an important thing. It's an okay thing to talk about, and we want to make sure everybody is comfortable talking about it. So just one example of where an organization, it's a relatively small business, was able to change some of the culture and the conversation around mental health to help create an environment of safety around those conversations.
I'm glad that you mentioned the restaurant example, because we do have another one from the audience that is specifically talking about suggestions for the food service industry, where many employers, especially in terms of independent restaurants, don't have the financial resources to provide EAPs. So as many of these companies are teetering on the edge of destruction, extinction, it's not likely they'll be able to provide programs like these. So does anyone have any suggestion about what you could do to creatively bridge that gap for the EAP?
Well, there are some programs out there that will do it, engage in those kind of conversations and trainings for free because they're grant funded. So, Mental Health First Aid, the website is a good one to look at as a first step. To be able to have those kind of conversations. It doesn't necessarily help get people connected to care, but it normalizes getting connected to care. And another one is called Forefront Suicide Prevention. That's here in the Puget Sound area, but they also have connections all over the country. So there are avenues to be able to begin and take that first step without necessarily having to have some of the financial resources to do it.
I have questions about questions also. One is from Stacy, who's saying, can you recommend a few questions for me to use in a check-in survey for my remote workers? And I'm sure any one of you can answer this because you're all hands-on with your teams.
Yeah, I mean, I can drop in. I would say, so there's the sentiment components, which I think this is sort of talking about. And they're really, I'm not sure how we get the perfect phrasing, but, the main gist of the questions really are, for one, if you're in urban areas, right, in like major metropolitan areas as we are, there's questions about commuting corridors, right? Because remember, it's not always just about being in the office, it's also how do you get to the office and how do you do so in a safe manner? So one set of questions we've asked, is about, people's commuting corridors, their preferences, and whether or not they are comfortable being in the office. Are they comfortable getting to the office? And in what way, could we help facilitate that? Because there's things, we're thinking about. The second thing, of course, then also comes to, for one, would you be willing to come in, but then also, can you do it at a part-time basis? Like, can we do some type of desk share arrangement, right? How wedded to you are you to your physical space, to your exact desk versus a desk sharing kind of office environment? So, I think it's a lot of just the sentiment questions, and then also just checking in to see how they're doing, right? Like, just to get a sense of like, how do you feel right now? Like, how are you, give a sense of, where are they on a continuum of, loneliness or, isolation, or feeling like connected and feeling like productive? Are you able to do your work to the degree you were previously? We've asked questions related to, do people feel like they're working from home, right? Because I think we all sort of recognize that that's actually happening. So that's just a couple of, ones that we've got out there. I'm sure the panelists have some others.
I'm happy to go next. I kind of would bucket it under kind of 4 different areas. First, listening; second, asking; third, acting; and then fourth, kind of responding. And what I mean by that is everybody's experiencing, different feelings and emotions. So simply listening and asking how people are doing, just as Marcos has said. Second to that is asking what kind of support you can provide your employee. Everybody's going to be experiencing a different situation. And just because you're asking doesn't mean you're going to have to fulfill all the different requests, but acknowledging the need, committing to finding out a solution, and then kind of responding if there's something you just simply can't do, making a commitment to find ways to find alternatives, and to really kind of meet them in the middle around what you can provide them as they're kind of dealing with, the changing environment surrounding them. So for me, I think you have to kind of start with empathy and compassion and kind of listening before you can move anywhere, because you can have process and policy in place as we're kind of shifting and trying to determine what the new normal is. But if you don't start with really feeling and understanding how your employees are feeling, you kind of will really go nowhere. So.
And Maria, I don't want to let you off the hook quite yet. Wendy is particularly interested in your 6-question survey, and if you wouldn't mind sharing the specifics of those 6 questions. You mentioned that at the beginning.
Yeah, I'm happy to. I mean, they're pretty simple. We ask one question on leadership role modeling. So how our employees are perceiving leaders are role modeling health and well-being. We ask if their direct manager if they feel like their direct manager is supporting their health and well-being. We ask how they're feeling about peer-to-peer support. So we go high, middle, and low. Senior leadership, manager, peer-to-peer. We ask about workloads. We ask about mental health specifically, if we're providing the necessary support and resources. And finally, we ask a general question about, does our organization, are we behind what we say we do, and do they support overall well-being? So it's a very simple, 6 simple questions that really try to get at every angle on how we're supporting well-being for our workforce.
Anyone else want to add specific questions that you ask? Would you like to share?
I'll go ahead and add it. We function under 3 buckets, if you will, and it's personal well-being, work and work life, and then how you are with your manager. And so we do ask some questions about, do you feel connected with your manager? Do you feel like you know what's expected of you, and things like that? Because again, we want to make sure that while they're working at home, they are comfortable with it and they are aware of what's expected of them and what they need to do, but also that they're able to manage it. We look at their ergonomics and ask questions about that. Do you have the appropriate setup? And we ask it in such a way of, where are you working? Are you working from your couch? Are you working from your kitchen table? Or do you have a home office? So, and then we follow that up with various sessions on our Wellness Wednesdays, and our safety group does quite a bit with it, but on how to set up a home office and things like that. So we were able to directly answer those types of things. But so we always ask about person's well-being, how they are in their work office or their home office, and then how connected they are with the company and their manager and so forth. So very similar.
One that I'll add is just a question around caregiving, whether there are any elderly or children or family members, children that they're taking care of. But we've adapted our survey every week, similar to some of the other panelists. Our first few weeks of surveys led to what we call a lifestyle spending account for home office furniture. Most fresh out of school employees of ours live in a very small space, did not have desks or chairs. There was a policy question of whether we let people come into the office and get chairs and how we would organize that. We decided on giving everybody an allocation that they could use to buy, home office equipment, a chair, a desk, which many of them didn't have. Even internet was something that was surprising to me. I thought something that everybody had. If you're at work all the time and you have a mobile phone, you may not have a home internet line. You may be paying for overages. So these are some of the other questions that we asked, and I think it's important to keep it fresh. Otherwise, people just get bored of it. You see, like, the drop off. It's like the same old set of questions. We've kept some that are similar around mental health, overall physical well-being, but otherwise we've kept it fresh.
Piedmont, we have distributed to all of our frontline workers, and then we home mail to everybody that went working remote, and we call it the Piedmont Cares flyer, and CARES is an acronym for communicate, act, reassure, and empathize. And under each of those letters, we have little bullets that leaders and frontline workers can use to sort of trigger, all right, how am I going to communicate about this? Or what is the best way to act here? And how can I reassure with, my coworkers? So happy to dig into these bullets, but I do want to recognize the time.
Yeah, I want to just do, with the last 5 minutes that we have, I want to do a lightning round. And I want to ask you all if you think that employers writ large are going to have to change their menu of benefits post-COVID. And if so, what is that going to look like? Is there one specific benefit that you think is definitely going to need to be added to the menu just after all of this settles down, if it ever does?
I'll go first. Sorry. So I think going back to our conversation on telemedicine, right? So most of us were already there, but a lot of times telemedicine was sort of like to some extent an afterthought or a nice to have. And I think it's gained a level of primacy now, where many of us are going to want to look back and not only to say, do we have a separate, distinct telemedicine, right, component, but really, do all the things we do and all the programs we engage with have telemedicine capabilities coming online or built in, and it just, I think that virtual need, and we've talked about capacity issues in mental health care for years and years, and there have been, quite a lot of products to market in the solution space around AI triage and health coaching and things like that. But I think those really will have gone from, oh, that'd be nice to, like, we need to have them, right? And like for us as a global organization, we're actually thinking about even globally, like, where these missing. And I think as individuals, we'll be looking at our own provider relationships and wondering how even private practices and private doctors and hospital systems and others are going to be building in telemedicine and more cohesiveness in terms of like electronic medical records and things like that. And how does my information go across, whether I have a telemedicine intervention here and then I go see my provider there? That can't be a disparate health experience anymore. We've got to get those things connected. So I think those will be the big programs that we'll be looking at for sure.
So I'll go ahead and chime in, but and this will be very quick. I don't know if it's necessarily different benefits or new benefits, but I do think companies are going to have to start thinking about how they promote, provide, and how the benefits are accessed. So I think that's going to be a shift. I think we are no longer in that, we're changing and we're moving, we're evolving, and it's going to be more virtual. So I think it's adopting that and moving forward.
I think we're going to see an acceleration of companies modernizing their infrastructure. The OnStar button, a lot of, if not all, services be available digitally. I think there's a real question that we haven't really talked about, which is, certain industries economically are going to be in very bad shape. They are in bad shape, and the recovery will not be quick for certain industries. And what I think we can expect, and this is a real, I think, challenge for a number of communities, is that some companies will be cutting back on their benefits and be cutting back on what they offer, and things that may seem or may have seemed extra in the past from the lens of a CFO may now seem like they're just not affordable. So I think that is going to be the real challenge, especially when we all know that we need more mental health and services like digital therapeutics. CFOs are going to be pushing back. Not every company is in the luxury or has the luxury of thinking long term. And while people say it, not everybody does prioritize their employees.
I'll go next. Yeah. Oh, So for us, I think we are still continuing to learn what changes need to be done. I think we're still kind of in this short-term model around some temporary benefits, of course, to address the immediate needs of things like childcare and leave. So I think there's still a lot of learning to understand what the next phases are going to look like, and very much like what Robin said, how they're accessing those benefits is going to be really key. I think where we're kind of focused right now is more in our administrative settings, and really taking a look at telework policies, work flexibilities, and what does that mean operationally for us as an organization, because we are in many regions across the country, and that looks different, by state. So, those are some of the early things that we're thinking about. So, we haven't really quite gotten to a place where we identified a key few things that need to be significantly changed around benefits. I think we're really still in very much learning mode.
Thank you, Maria. We are going to have to end here so that we can end on time. I'll toss it over to Nick.
Thanks so much, everyone. Much appreciated. Thank you, Lydia. Thank you to all of our great speakers. That was a great, insightful, and detailed conversation. Thanks again to League, Justworks, and Lumapps, and to all of you who have joined us today and are participating. If you'd like to join us for more virtual events, you can head to our website, fromday1.co, that's fromdayone.co, and check out more of our upcoming webinars. The next two are this coming Tuesday, June 23rd, The Burnout Factor, New Insights for Stressful Times. Thursday, the 25th, Talent Outlook 2020, Defining the New Contours of the Labor Market. Thanks so much for joining.